Sexually transmitted infections are common across college campuses. To keep yourself safe and protected, make sure you're using condoms when having sex, or STIs are going to crash your party.
Hey guys, my name's human papillomavirus, but you can call me HPV. I'm pretty sneaky because I can infect you and you won't even know it for years. Although I may look pretty friendly, there's more to me than meets the eye. I'm a group of 150 different viral strains, and I infect 14 million people per year. You'll get to meet me if you aren't careful during sexual contact with someone I'm hiding in. Best part, you'll never know who that is. Unless they got screened and vaccinated, I exist in 80% of people who are sexually active. 99% of all cervical cancer and genital wart cases are because of yours truly, plus my 9 best subunits of viruses. If you get genital warts from me, you'll notice small bumps or groups of bumps that can be raised, flat, or cauliflower-shaped. When you start getting pap smears and physicals at age 21, you'll find out if I caused you cancer. Pelvic pain, red or yellow inflamed nodules on the cervix are my specialty. But although I love the cervix, I can cause penile, oropharyngeal, and anal cancer. If you want to avoid me, the CDC recommends kids at the age of 11 to 12 to get a set of 3 vaccines 2 months apart. There's no time for that. All right, I gotta get back to this party.
Not so fast, HPV!
Not you, Gardasil!
Hi, I'm Gardasil, and I target the main 9 viral subunits to prevent HPV-related cancer in genital warts in girls and boys. I only have minor side effects too, injection site rash or burning that will go away in a couple days. Also, headache, dizziness, and possible fever, but believe me, I'm worth it. And even if you haven't gotten vaccinated in adolescence, you can still ask for me at your annual physicals until age 26. Although I will keep out old HPV, practicing safe sex while in a monogamous relationship will help decrease the risk. Although, if your partner's already infected, condoms can't cover everything, so it's important for people aged 21 through 65 to get annual screenings and people for 11 to 26 to get vaccinated with me.
Hi, I'm herpes, but guess what? You can call me the herp. And guess what? I'm here to stay. I come in 2 forms, HSV1 and HSV2. HSV1 is known to be the herpes of the mouth. It can be transmitted from saliva, so wash that mouth. It can cause oral infections, such as cold sore, or other infections of the mouth, such as the lips. HSV1 can even lead to genital herpes and can include rashes or clusters, or even inflamed, painful vesicles. Ooh, ouch! Sounds bad, right? But don't forget about good old HSV2. That is more commonly known for being genital herpes. It is spread from skin-to-skin mucous membrane contact. The initial infection is usually asymptomatic, you really don't get much, and then it gets worse with recurrent exposure. The lesions begin as small vesicles and progress to ulcerations within 3 to 4 days. And then remember, you can't get rid of me. Ha 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 ha.
No need to fear, a Elsevier is here.
Oh no, not you.
You better get out, herp.
Okay, I'm out.
I'm here to inhibit your viral replication by affecting your DNA synthesis by blocking the polymerase enzyme that normally stimulates new genome synthesis. But sadly, I can also affect the body cell DNA synthesis. So I'm not recommended for immunocompromised patients because it can do more harm than good. I'm indicated for initial and recurrent herpes, including both HSV1 and HSV2. I come in 3 forms, oral, topical, and IV, so you've got options, people. Also, I can be hard on the kidneys, so long-term use can lead to nephrotoxicity. Also, for all you new nurses, if I become infiltrated, you need to administer hyaluronidase to get rid of me to avoid necrosis. So get it right, people.
What's up, party people? My name's Syphilis, but you can call me Sci-Fi or Sif. I went away for a little bit, but decided to make a comeback, and I'm now on the rise, affecting men and women at a rapid rate. I progress in stages, primary and secondary, both of which are the most infectious of my disease process. If I am not treated, I can cause stroke or visual impairment. Or even worse, I can progress to neurosyphilis, which can cause headache, numbness, and paralysis. But most often, I like to stick to infecting people with the hard-to-identify cankers that hide underneath folds on or in genitalia. I'm also great at increasing your risk of acquiring and transmitting HIV in men and increasing the risk of infertility in women. The best way to keep me away is to make sure you're using condoms whenever you're having sex and to get tested regularly. STD screening is critical for both men and women.
Hey, Syphilis, get out of here! How's it going? I'm Penicillin G, and my main job is to help you get rid of syphilis. I'm so good at my job that only a one-time IM injection is needed, only if it's uncomplicated, so leave that complicated stuff at home. My main job is to inhibit cell wall synthesis during bacterial multiplication. Luckily, my job gets done pretty quick, but I still do come with some complications. It's not my fault I interact with so many drugs. My most common adverse effects are allergic reactions, including hives, itching, and angioedema. I can also mess with your GI system, causing you plenty of nausea, vomiting, diarrhea, and taste alterations. But hey, what's a little nausea and vomiting? That's better than syphilis.
Hi, my name is Chlamydia. I affect 2.8 million people each year, most commonly between the ages of 15 and 24. I'm the most common bacterial infection. I'm usually asymptomatic, so you don't even know I'm here. I might cause burning while you urinate. I cause infertility, ectopic pregnancies, and pelvic inflammation disease. So ladies, watch out. I'm also the leading cause of blindness. My friend couldn't make it today, gonorrhea, but normally we're inseparable and you get us like a 2-for-1 deal. I cause women to have odorous green discharge, and men, sorry, but it feels like you're peeing out razor blades.
Hey, I'm ciprofloxacin. What you doing here? And I'm azomycin. Get out of here! Hey guys, ciprofloxacin here. I'm a broad-spectrum antibiotic. I stop DNA synthesis, but I also increase the risk for tendinitis, tendon rupture, and I increase weakness in patients with myasthenia gravis. Please stay away from ice cream because dairy makes Cipro less effective. Also, watch out for prolonged QT waves because I can cause arrhythmias, which can be lethal. Azithromycin here. I'm a macrolide. I inhibit protein synthesis at the level of 50S bacterial ribosomes. I'm a hepatotoxic drug, so you better check your liver. Also keep an eye on your heart for cardiac complications. I stimulate your GI tract, so stay close to the bathroom. Oh. Yo, my name's Human Immunodeficiency Virus, but you could call me HIV, and I put the retro in retrovirus. Since I became so popular back in the 80s, my street cred has been going down, and there has been a huge drop in HIV transmission, so I'm real pissed. But whatever, you want to know how I work? I bind to CD4 helper T cells, which are very important in the human body for the immune response. I integrate my RNA into the human cell DNA by converting my viral RNA into double-stranded RNA via reverse transcriptionase, and when the body cell's DNA gets activated, it makes me more HIV viruses so I can infect more CD4 cells. And after about 10 years without treatment, I can turn into acquired immune deficiency syndrome, or AIDS, and then you're done.
Hi y'all, Elsevier here. I'm a protease inhibitor to help you with that pesky HIV. Okay. I can come alone or I can bring my other anti-HIV friends to the party. I'm best absorbed in a gastric environment, but I don't get along well with high protein or high fat foods. They slow down my absorption. I'll help increase your CD4 counts in the body and reduce that viral load. I think I'm pretty great, but my only minor flaw is I can cause kidney stones in only like 4% of people, so you might want to make sure you increase your daily intake of fluids to about 48 ounces per day. Other issues I can cause are nausea, headache, diarrhea, vomiting, abdominal, back, or flank pain. But if you choose to bring me along, I promise to slow down the progression of HIV.
For more information about STD, go to cdc.gov/STD.
And in your free time, you can walk up to the UNR Health Clinic and get free STD testing every Thursday from 8 to 10 a.m.
And I got free condoms.
Don't let STDs ruin your party.